Bueno, muchas gracias a todos por estar el día de hoy.
Thank you very much for being here today. Good morning, good afternoon. This is the second part of our previous webinar on legislative mechanisms. And today we have other experiences that we will be hearing about. The experience of Sardinia. We have Dr. Carmen, who will be with us again today. We will also hear from the experience in the United States. Let me remind you briefly that this is a webinar that is being broadcast through social media, YouTube, Facebook. And I would like to remind you that it is very important for us to receive information from you on the chat, what country you're joining us from, and your organization. This initiative that IICA has developed, and where I coordinate the aspects related to training. Sorry, my name is Erika Calderon. I didn't say that at the beginning. And a series of agencies that are working together under the framework of the GFTATs. And this includes WOAAH, which was previously the OIE, CaribVET, CAFSA, OIRSA, the CAN, as well as the USDA, the CVP, and COPEG. We are a group of agencies, an interagency group that has been working on the fight against ASF, African swine fever, to avoid its introduction in other countries of the Americas and the Caribbean. Like I said before, we have a second part for you today regarding legislation. Legislation is a very important topic for our region and for the countries in order to prepare for this disease or for any disease that requires an emergency response. Like I said, today we will continue with the different topics. We will have our first presentation given by Dr. Carmen Boulon from FAO. If you have any questions during this section, the questions and answers section is usually held at the end. But if you do have questions, since Dr. Boulon has to leave early, I do recommend that you write your questions starting now. Yes, if you can start posting your questions on the chat at the end of the presentation of Dr. Boulon, she can have the possibility of answering these questions. So after her presentation, we will hear from others, but first let me introduce her to you. She has a master's in law from the European Union with postgraduate studies in international trade. Before starting to work at the FAO, she worked in the Department of International Relations and Community Law of the Public Administration of the Autonomous Community of Galicia. For 16 years now, she's been working as an officer in the Law Service for Development of FAO. There, she works on topics related to animal and plant health and food safety, as well as agricultural production and the One Health approach. She has worked in more than 50 countries, as well as different regional organizations supporting the development of legislations and the strengthening of capacities and legal issues regarding agriculture and food supply. So without further ado, let me introduce to you Dr. Boulon. She will be discussing different elements for legislation in animal health as the second part of her presentation. Dr. Boulon, go ahead. Thank you very much, Erica. It is a true pleasure to be here with all of you today. Can you hear me okay? We can hear you very well, Carmen. Thank you. As I was saying, it is a true pleasure to be here with you today. This is the second part after the first session that we had a few weeks ago. Today, we have the purpose of trying to describe more in detail certain aspects that I described in the previous session. So if last time we maybe discussed more generally about issues of animal health and maybe what international standards are that are considered a reference when it comes to animal health, the idea of today's intervention is to be a bit more concrete regarding the content of reference international standards when it comes to African swine fever. I've heard that there is great interest regarding what measures are implemented to restrict imports in order to restrict a possible introduction of phytosanitary risks regarding ASF. Let me share my presentation and you can tell me when you can see it correctly. We can see it now. Is it in presentation mode? Yes, it is. So let me just tell you briefly that the presentation is at your disposal, and also we can send you the standards that I will refer to throughout the presentation. Let me refer to two main things. So in a very succinct way, I would like to describe what I mentioned last time, which is why it is important to have a legislation for animal health and production. What is the role of legislations? Then we will delve into the details and the elements to draft standards for prevention and control of ASF. So why is it important to have an animal health legislation? Well, because the measures included in international standards are important and are useful and must be introduced in other legal instruments. So legislations are useful to establish clear national priorities and objectives and to make them sustainable over time. This means that maybe a public policy priority that could be due to a specific situation or a concrete interest, maybe through its transformation into a legal instrument, it may become something sustainable over time and also legally binding. It's also important to have a legislation to designate competent authorities and also to recognize what competencies are needed in order to reach these objectives when it comes to public policies. In this way, if a competent authority does not have certain faculties or capacities, and these are not recognized in a legal standard, they will not be able to intervene through restrictions that also may affect private property or free trade. It is also important to establish responsibilities, obligations, and prohibitions for the different stakeholders, including the private sector. Why? For standards that will be establishing obligations for producers, if they are not in the legislation, no public authority will be able to demand that they be fulfilled. So they must be included in the legislation to make them mandatory. And also to establish control mechanisms such as licenses, permits, or certification requirements. Everything that is, all of these things are very important when it comes to sanitary measures because they usually restrict the freedom of the merchandise to circulate. It's also important to have a legislation, to have a body of inspectors and to award them with the necessary faculties or powers to supervise the compliance with the law. And these inspectors must also be able to establish any sanctions or pertinent measures. And this is the final point. And why do I say this? And this I mentioned last time. This is because this is the key to describe why it is important to have these priorities established in a legal instrument. There may be sanitary priorities in a country, but if the legislation does not reflect those needs and the competencies of the public authorities or the power that the inspectors have, then they will never be able to be implemented effectively or immediately without a need to wait or to establish a parallel process. So these standards, these sanitary standards and regulations, which have to do with restrictions that have to do with the SPS measures, have to do or are regulated internationally through the agreements of the WTO, particularly the SPS agreement, sanitary and phytosanitary standards, which establishes that the countries should not approve sanitary measures that restrict international trade unless these measures are necessary to maintain the adequate health level, and also establish a series of standards. They cannot be discriminatory. They have to be applied equally for internal production as well as for imported products, and they mustn't be stricter than needed in order to protect the sanitary status of the country, and must be proportional to the existing risk. They must be limited in time only to contain the risk, and have to be risk-based and have scientific grounds. The SPS agreement also invites countries to prove this and to use international reference standards approved by 3 organizations that become the reference organizations when it comes to animal health, which is the case of the WOAH, the IPCC, and when it comes to food safety, the Codex. So when a country incorporates into its legislation standards that come from standards that have been approved within the framework of the WOAH, it is understood that those standards are science-based, they are not stricter than necessary, and they will be aligned with the requirements of the international trade standards of the WTO. Therefore, the standards established by the WOAH, the Codex of the IPCC, becomes a very important standard to draft sanitary measures that will be applied both for national production and also in the framework of international trade. We must remember that they must be non-discriminatory, so for national production, equally, yes, and that can be a requirement for imports as well. So let's see what the elements are that serve as reference and the standards, particularly for ASF. When we include these international standards in our national legislations, they must be aligned with the WTO standards. They will not create unnecessary barriers to trade, and they will be harmonized internationally and in line with this. This is in different codes, and we have the code for terrestrial animals, for aquatic animals, and also for diagnosis for both types of animals. And several of the titles that are included in the WOAH code for terrestrial animals have to do with African swine fever. There is one specifically, chapter 15, which describes specific measures for the infection caused by this virus. And this chapter, in several moments, refers to other chapters. For example, Title I, when it comes to diagnosis, surveillance, and notifications of animal diseases. Title IV, prevention and control of diseases. Title V, trade measures, procedures for import and export, etc. So all of these titles will provide us with the elements that then we will be able to apply in a legislation or regulations regarding African swine fever. Another topic that I would like to discuss with you is the fact that in order to draft a standard for ASF, we must consider international standards. So how do we include it in our national legal framework? This will depend on the type of legal system of each country. Each country, of course, have different sources according to their legal system. And so in a more general way, we could say then there's a differentiation between primary and secondary standards. Primary laws are generally approved by the parliament, not always, but usually, and they are like the major mandates of the different ministries, and this is at the highest level, yes, and they will be authorizing the ministers or other public entities in order to draft implementation standards for the secondary ones. All of these are necessary to establish the different competencies and responsibilities of the veterinary authorities. So who will be competent to approve the standards and which will be the competent authority to implement them. So if I don't have sufficient legal basis to determine, okay, the veterinary authority will be approving these standards to restrict imports, it could not be approved through a regulation. We have to have that legal basis. And also, it will be necessary if there's a restriction of some kind of freedom. So if I want to approve a sanitary measure through which an inspector can go into a private property and apply a sanitary measure, I have to, if I have it in the legislation, it works differently. So what one needs to do when developing this type of implementation measure for ASF or any other disease is to pay attention to what I have in the parliamentary laws, yes, and primary laws, because only in the framework of that context, I will be able to develop these regulations. And this is particularly important, like I said before, when designated the competent authorities, as well as the distribution of the different powers of the competent authorities to implement those measures.
These parliamentary laws are not flexible because they'll need approval, and that takes several years. And that is why the most concrete, specific measures are usually approved through secondary measures that are more flexible, that are usually approved by ministers or council ministers or by the executive. And what they are good for is to be able to detail the competencies that have been also included in the law. And in the law, it has to do with all the veterinary authorities, all the responsibilities of the operators, because these will be obligations of the operators with public competencies and all the public organizations, everything that has to do with sanctions, with raids and infractions. And so at the level of secondary legislation, that's where somehow they will have a greater flexibility and they'll be easier to regulate the key elements of surveillance systems, the definition of a case, the concrete sanitary measures, and what has to do with the things for registration and identification of animals, or restrictions specifically for the importation or the import of products. Now, going into the most particular things of the elements that need to be included in a PPA standard, we are going to use the one that is included on Chapter 15 of terrestrial animals. And specifically, the first element of any regulation is its scope. And we also need to know or jurisdiction. And then we also have to know if something that is will be ruling on PPA must take into consideration the jurisdiction or scope that based on WOHS standard, it will be necessary to control PPA. So what this Chapter 15 tells us is that we need to take into consideration all the varieties of domestic and wild, and also the ticks of the ornithodorus genre. And when we're looking at developing this standard for PPA, many countries, when they are developing this type of studies, they find that their veterinary authorities do not have the authority to apply sanitary measures in wild areas, or also they don't have any authority in terms of fauna. So in this case, to apply the sanitary measures, they have to coordinate with those in charge of the environment or those in charge of the protected areas or wild areas. So that's why we usually recommend for the legislation in terms of animal health should take into consideration not only domestic but also wild animals. And before developing a regulation in this area, we need to pay attention to what is the scope of my animal health law, which are the animals that will be included, which are the competencies of an authority of a veterinarian within its primary legislation framework, and if this covered or not the domestic animals and wild animals as well. Aside from this, and this is one of the first elements, that the PPA needs to be included as one of the diseases that are mandatory to report. And so this will have different impacts at the legal level. First of all, there is a mandate to report the WOH that they exist, but this is also applies for owners of the animals, for veterinarians, and for the authorities to report on any occurrence of any case of PPA or any symptom that might lead to suspicion that there is a case of PPA. So what does this mean? That there is that it's mandatory for them to report. Well, that the authority can say that the professionals and the animal owners and everybody else will be notifying about any suspicious case in the shortest time possible. And otherwise, there'll be some administrative or other type of measures applied. So this notice is mandatory, and it is both for the private sector. So there's got to be a legal foundation at the parliamentary level, and very specifically for PPA in an implementation standard. And in the chapter 15, it also tells us about different functions of the competent authority to fight against PPA. As I said before, it is important for you to have some legal standing in the parliamentary law. First, you need to have some surveillance control and monitoring systems. And maybe sometimes we only see the development of surveillance, prevention, and control that are general for the diseases that must be reported. And this can be also included in a regulation. We also have the need to have an emergency plan or a prevent alert and emergency plan, because once this emergency is declared, the competent authority will have an extraordinary unlimited power in time and proportionate to what is happening to be able to approve specific measures that may be more strict than the ones that can be approved when there is no emergency. And this is done because these animal diseases and also for vegetable pests do not understand about administrative restrictions, and they can just spread if no immediate measures are adopted. So to approve immediate measures that may support the necessary restrictions to contain a disease, competent authority is given extraordinary powers when there is a declaration of emergency or a quarantine is declared. Also, competent authorities will have the need to approve a compensation system. And this compensation system is a measure that is recommended to facilitate notification. If there is no possibility for the competent authority to compensate in the case the animals are slaughtered, or in case there are some health measures that will affect the income of producers or the animal owners, they will not be happy to report cases, or they will not be applying sanitary measures or health measures that will, and they might try to just stall, contain the disease, to avoid having some economic losses that may be significant for them. So through a compensation system, we promote notification because the producer will see somehow a compensation when complying with their notification obligation. And in the public sector, what we promote is to have this notification obligation, and these compensation systems are mandatory too, and that they will be covering some of the loss. Also, competent authorities should facilitate the public-private participation and the use of private sector and the participation of private sector in the application of health measures. So the standard suggests for this to be included as well. Other elements that are included in Chapter 15, and this is a very important element to make sure that any surveillance program works, is to be able to identify animals or facilities through a census or a registration or through animal tracing. Countries have developed this animal identification plans that will identify a number of species. And swine species are usually included there, but there are many other countries that do not have this more comprehensive type of systems, and that help the identification through census that might not be targeted to individual animals, but to the whole production facility. And this will help track and establish a surveillance program as established by the health standard. And as this system for surveillance, prevention, and control for ASF is established, is one of the things also established in Chapter 15. There should be a continuous surveillance system that is based on the establishment of zones, as free zones or infected zones or buffer zones or contention zones. And this will also, we're going to talk about this briefly. We'll talk about what are the measures that need to be applied depending on the type of zone, and also how they can go about in establishing a zone as free or disease-free. Sometimes declaring a disease-free zone is going to be recognized by WOH. So the competent authority may declare a PPA or ASF a free zone if the requirements established in Chapter 15 are fulfilled. Also, it depends on the type of different zones of free containment or buffer zone and prevention area. So which are these measures for zoning and compartmentalization that we have in Chapter 15? So to declare a swine-free, fever-free compartment, we have the establishment of a continuous surveillance system, also a control of infections, which has all the different measures depending on the type of product. And then we'll see what are the measures. And also a program for the elimination of food products from different transportation systems that come from infected countries. This is also for free zones. There is some information for PPA free zones. We have that in Chapter 15 and also in Chapters 4.4 and 4.5 that also talk about that continuous surveillance program. In the case of a containment zone that is defined as one that has a limited outbreak where the infection is under control, it is important for surveillance programs to include all susceptible animals as well as the vectors of the disease. And it is important for this containment zone or controlled infection zone to be limited and to have a specific surveillance program. So once it has been established, the rest of the area or adjacent areas may be considered as free as well. So the general criteria applied in containment zone are included in Chapter 447. So there's got to be movement control for animals, but also of people and transportation means that may have been in contact with infected animals. There is also epidemiological research requirement that will somehow help us to find out whether it's a case of ASF compared to classic swine fever. For the application of stamping out or other effective control measure to be then for animals to be identified, also the reinforcement of passive surveillance, and for the implementation of necessary health and biosafety measures so that the disease is prevented from spreading into other farms and maybe slaughterhouses or other places where the health is applied. So we can also declare a free zone when there has been no cases in a certain amount of time, also of negative results when there's sentinel pigs, also if there are chicks functioning as a vector, and to have as a possible measure the sanitary slaughtering or culling. This is something acknowledged or recognized in the legislation because it will affect the assets of the farmer. So since it is affecting the patrimony of the farmer, needs to be clearly defined in the legislation. The early alert system and emergency response in case of an emergency response needs to be also part of the surveillance program. So it requires the competent authorities to develop a response. In the case of emergency, there's got to be an emergency team that is always there available to apply the necessary measure that has to have a national, regional, departmental, and local coverage, depending on the incidence of the outbreak. Also, the authority needs to be given the possibility to declare an animal health emergency. And here I wrote the importance of the chain of command. This is one of the things that we usually think are more complex. For example, in federal countries or in countries that are, or in places that are not centralized, where the declaration of an emergency might not be done centrally. And so the central authority finds a difficulty declaring these animal health emergencies in decentralized territories. So it is very important to contain a disease when there are transboundary issues among different territories in a country. It is also necessary to have the power by the competent authority to approve measures applicable throughout the national territory to deal with the emergency. And this is something that has to do with what I mentioned before about decentralization, that on one hand, we have the declaration of the emergency, and in other countries, there are cases when this is not the competence of the veterinary authorities, but of somebody else. And when making the decision of declaring an emergency, they need to take into consideration other factors that go beyond just the technical aspects related to the animal disease. There are political, economic aspects, or maybe we're talking about an authority that may declare the national emergency at a higher level and that may require some more cumbersome processes when declaring this animal health emergency. So what is recommended is for the veterinary authority to be able to declare an animal health emergency. And this does not mean that this is a national emergency or a public emergency or public health emergency, but exclusively this type of emergency, animal health emergency, that may help us adopt measures in terms of animal health that will help us contain a disease, an animal disease. And aside from declaring this emergency, for this declaration of emergency to allow the veterinary authority to apply sanitary or health measures in the entire country's territory. And what we talked about before, compensation as a way to favor notification with a calculation for the quotas and calculation of contributions, and to have health insurance as an alternative to compensation by the government. Other elements that may be good for the development of a PPA standard is that Chapter 15 also talks about the measures to be approved and implemented in the event of an outbreak. We already talked about many of these, about surveillance programs, sanitary slaughter. We also need to define the cleaning, disinfection, and biosafety measures to be applied. And we're going to be talking more about that in a moment, and to establish and regulate the quarantine for farms and establishments. And sometimes it was just going to be localized in one place, and in others, it will be spreading through a larger territory. And veterinary inspectors, for them to be able to implement said measures, they will need a number of powers or capabilities that need to be acknowledged at the parliamentary law level or legal level, but they can also be approved through a bylaw, like the animal inspection and sampling, the confiscation and destruction of animals or their products, to approve measures for the control of animal transport, and measures to prevent the movement of transit of risk products that can be meat, milk, leather, hair, semen, slurry, and manure, to apply protocols for virus inactivation in fresh meat, waste, casing, skins, and trophies, sows, and manure. So, as you can see, the application scope is very wide because the definition of risk product in the case of PPA is also very wide. So, the standard needs to cover all the potential scenarios where the disease or the risk for the spreading of disease may occur. Some obligations and responsibility of the private sector. We also have to have a legal foundation or basis in a law. This starts by the application of biosecurity measures established by competent authorities to avoid contact with and between infected or suspect animals, washing and disinfectation and harmful fauna control, the prohibition of feeding untreated sold pigs, the protocol for the destruction of residues, carcasses, and wastes. For example, the other day we were talking about we were talking in a country with producers that talked about the difficulty that they had in doing some efficient destruction when health or sanitary measures indicated that the sick animals had to be done in the establishment, in the facilities, to prevent the transportation to slaughterhouses, and how then by training and supporting producers could help so that they do the right destruction, and the provision of export of animals and animal products in case of an outbreak.
Como les he comentado, los requisitos de importación son bastante amplios y bastante específicos.
Import requirements are quite broad for the different types of products, and they can be considered as risk measure. And why are they so important? Because only if we reflect what is included in international standards, I mean, this is the only way for these to be implemented at a national level, but also for international trade. There are a series of goods which are described as safe goods and therefore are not subject to restrictions. One of them is meat, which is airtight sealed with a value of an FO value of 3 or higher, and the other one is gelatin. So they could not impose restrictions to imports of these two products because these would be considered excessive restrictions that are not proportional to the risk of transmission of ASF. As regards to import requirements For domestic and wild pigs, when these animals come from an area which is free from ASF, it is required to present an international veterinary certificate establishing that the animals did not show any clinical signs, that animals remained in a country, zone, or compartment that is free from ASF since its birth or for the last 3 months. And if the animals are exported to an area or compartment which is free, or to a country infected or an infected zone, that all precautions have been implemented to avoid contact with the virus. When they come from a non-free area, an international veterinary certificate must be presented showing that no clinical signs appeared on the day of the shipping and that they remained in a free compartment or at least for the last 3 months, and that they remained quarantined, isolated during the 30 days prior to shipment and tested negative in a virological test at least 21 days after their entry into the quarantine station. These are other specific requirements for the genetic material which describe the need to apply an international veterinary certificate. When it comes to free areas, a veterinary certificate must establish that the animals, since their birth or the 3 months before the reproductive material was collected, remained in a country that is free from ASF, did not show any clinical signs, and that the material was collected following the biosafety and hygiene norms of CSAT. If it is a non-free area, the animals must have remained since their birth in these periods. And surveillance has shown that there have been no cases in the past 3 years, and it can be reduced to 12 months when there is no evidence of ticks in the epidemiology of the infection. Also, the animals did not manifest any clinical signs of ASF on the day the semen or the embryos were collected, and the material was collected following the CSAT standards. As regards fresh meat of wild and feral pigs, the International Veterinary Certificate must establish that they were hunted and killed in a free zone or area, and the results were satisfactory in a post-mortem inspection of the facilities in keeping with the standards and with the corresponding approvals. For meat products, the International Veterinary Certificate must establish that products were prepared exclusively with fresh meat that met the adequate conditions that we mentioned before, and also that they were prepared in a processing plant where the relevant conditions were met for processed meats. Or two, that they were prepared in facilities approved for exports by the veterinary authorities, and the procedures used guaranteed the destruction of the ASF virus, and that all contact with sources of the virus was avoided. In the case of the offspring, here the veterinary authorities must demand the presentation of an international veterinary certificate establishing that the female pigs come from domestic or wild pigs or a free zone or compartment and prepared in a facilities that approved for exports by the veterinary authorities, or were prepared in a facilities taking all necessary precautions to avoid the contact with the virus and with procedures that guarantee the destruction of the virus.
Por último, los requisitos de importación para el estiércol sólido.
Import requirements for solid or liquid manure and include veterinary authorities that must demand the presentation of an international veterinary certificate crediting that products come from domestic or wild pigs from a country that were developed in a zone or compartment that is ASF free, and they were prepared also in facilities with procedures that either destruct the virus or that all necessary precautions after the preparation were taken to avoid contact with any source of the virus. There are also other requirements for other products, which include, like in the previous case, an international veterinary certificate, which established that come from these domestic or wild pigs, and that they were prepared in a facility prepared for exports and approved by the veterinary authorities, or in a facilities used for the preparation with a procedure that destructs the virus of ASF, and that all precautions were taken to avoid contact of the product with the virus. So it either comes from a free zone, or the facilities, the establishment that the animal comes from has been approved for exports after having verified that the procedures used guarantee the inactivation of the virus and that contact has been avoided with any potential source of infection. So in order to be more detailed, Chapter 15 shows all of these details, and these requirements are part of the legislation of many countries already, countries that want to restrict the import of these products or that want to have a more active role. That is all on my part. I think we've skipped some of the aspects that have to do with the veterinary legislation, which is more general, and I went more into detail on other things. And the declaration of an emergency situation has already been described in the previous session. I didn't want to take too much time describing that, but if you want to ask any specific questions, of course, I am more than willing to answer them and have some kind of dialogue about this. You can post your questions on the chat or on the Q&A function, of course, and I will gladly answer it. Thank you. Excellent, Carmen. Thank you very much. Thank you for this presentation. These are definitely topics that we need to touch upon in order to be fully prepared and be able to respond to the emergencies. So in the case of ASF, we definitely need this as a region, as a hemisphere. All countries need to prepare for this. Several countries have posted some comments. In addition to official organizations such as the Agricultural Institute of Colombia, we also have the participation of the private sector in this meeting. It's a very important role, and this is definitely an integrated type of work, which requires training and preparedness, not only collaboration between international organizations that have worked collaboratively to provide you with all of this information, but I think this is important for all sectors, the academic sector, the official sector, the private sector. So it's very important to ensure this participation. Mexico is the agricultural sciences school from Mexico, also from ProNaive, from APOA, also from the Association of Pork Producers in Guatemala, and also from Canada, from St. Martin's, the French Caribbean, also from Mexico, Paraguay. So I encourage you definitely to continue participating. The Peruvian Association of Pig Farmers. I think this is definitely what integration means, yes, and preparation for preparedness for all of you. Remember that we are broadcasting this in 4 languages. You can listen in all 4 languages, and we're also broadcasting on social media, Facebook, YouTube. And without further ado, Dr. Carmen, I have 2 questions and 1 comment. Before you leave, Erica, no, don't worry. I'm answering through the chat, actually. I think I made a mistake on the Q&A. I think I'm writing the answer on the chat. Yes, but I think that it's very important to answer live, because not everybody on social media can read the answers. So Pastor Alfonso from CaribVET in Cuba has asked, which have been the most difficult aspects in terms of reconciling the scope of legislators and issues such as methods that do not affect animal welfare, and how to dispose of the corpses and the risk of environmental pollution? I'm trying to understand the question. Maybe Pastor Alfonso wishes to add something live, but it's not a legal question, actually. It's a technical question. And I think this depends on each country, right? Because in a certain way, this will depend on the different populations of each country. So how to dispose of the corpses, for example, we've worked on this a lot, and I was actually discussing this with colleagues a few days ago, especially considering the environmental risk and the risk of this disposal that does not necessarily guarantee the inactivation of the virus. So in this sense, it's not so much what is written in the law, which is, of course, the stamping out process, but also the need to maybe establish certain standards to dispose of this type of waste. I'm sorry, I was looking at another question. So I think that waste disposal, and there could be maybe standards that have to do with authorizations and with environmental impact to dispose of the corpses. These are sometimes extraordinary measures because exceptions need to be made sometimes to other standards as well, because many countries, for example, consider that preserving the sanitary status is a legal asset that they need to maintain. Yes, but it's very technical more than legal, and also very specific of each country. Alejandro Perez from Senasa. Which can be the regulatory tools that must be approved to promote the implementation of insurance by insurance companies in the face of a health emergency? I don't really understand the question. Maybe maybe they can clarify, but regulatory tools that must be approved in terms of insurance, I think have to do with how an insurance can either be mandatory or optional. I think this will be defined by the veterinary authority within the framework of the legislation. They can require, for example, if a pig farmer, in order to develop an operation, they need to have some kind of insurance, a mandatory insurance that covers the risk of emergencies. Usually, this type of insurance is subsidized, but this is a public policy measure that really depends on what the country wants to do. If they want to establish this type of mechanism, and I think that it doesn't necessarily avoid it's not, it doesn't really avoid other compensation measures. I'm not sure if I understand the question correctly, but if I haven't understood it correctly, do clarify and feel free to reach out. What do you recommend when a product such as ham complies with the established temperature, but not with the established time according to the WOAH standard? Again, this is very technical and very detailed, but in a certain way, the requirements of the WOAH are the ones that are used as reference, and those that the countries can adopt to develop their import requirements. And it's not so much in order to formulate the import requirements of a certain country, which is what we were discussing. But what we recommend is to follow WOAH standards. Now, if the question focuses more on what happens when the import requirements are not fulfilled, what should the technical expert of the export facility do? What should they do? They don't know what to do when they fulfill one requirement, the other one it doesn't. Well, this is a very technical answer that has to be analyzed on a case-by-case basis and on the basis of risk. I think maybe our, veterinary specialists here can discuss this. And they establish how the standards need to be applied. But there has to be a risk that has been proven, and the international standard, of course. Yes. Okay.
Carmen, si gustas, te leo los comentarios del doctor McAllister Tafur de la Comunidad Andina.
I would like to read, maybe if you want, what Dr. McAllister wrote. He is congratulating you for your presentation, and he's asking, would you recommend to include formally in a framework standard on ASF the need to have a swine insurance as something mandatory to promote reporting in case there is an emergency outbreak? Well, there are two answers to this question. One is a technical one, which I'm not going to deal with, and the other one is a legal one. From a legal standpoint, you would have to be very careful because this is an issue that generates an additional cost for the person. So you would need to see if you have enough legal basis to establish this type of measures with a legal basis. So to introduce something like this in a norm, in a standard, we would have to see if the authority has the power to have this as a mandatory requirement for all those administered. Because if it's not, you can have some legal problems when you have such a strong thing to comply with via a regulation. So that's why we have some countries that this type of insurance is legislated through the law, and then they're very strong and they're wide, or they do not only have to do with a specific disease, but they establish a whole system. I know some countries, not that many, that have established this type of mandatory insurance policies. One of them is mine. This is something that we work somehow as a measure to reduce risk and also a measure to facilitate reporting. But from a purely legal standpoint, you need to see if it works, because it may be very complicated and it may raise a conflict. So Alejandro Perez from Argentina is clarifying the question that you didn't understand. Just to clarify the question, he says, so for the regulations so that their insurance for health issues that happen, just like in the case of agriculture, it is very frequent to have, for example, crop insurance faced with climate events. Yes, that's exactly what we're talking about. That's exactly what we're talking about. There are certain countries that have some systems to reduce somehow the risks and to establish a mechanism via which farmers can have some sort of conversation through the insurance. So, or compensation through insurance. So this is particular to each country, whether they want to implement that or not. But there are some countries that are already implementing that. Yes. So Carmen, here we have another question by Dr. McAllister. It says, within the framework of the current health situation of ASF worldwide, what would be the reach of countries declaring themselves free countries, free ASF countries? And what would be the value given to this type of declarations in the EU? Well, I cannot tell you what would happen in the EU because we would have to ask lawyers or specialists in EU legislation. It's sad we don't have that many specialists in that area. We have some panel members from the EU that might be able to answer your question, but I don't work directly in that jurisdiction, so I cannot give you an answer on that. But as you know, the declaration of certain of being free from certain diseases before the OIE, like for some diseases in bovine and the classic swine fever as well, and mouth, foot, and disease. Well, these are some diseases that can have a area zone as disease-free, but that would be the mechanism. But the value, I don't know, that it'll depend on the country. Well, the last question, because of time constraints, here we have a question from Dr. Mark Trotman. He would like to congratulate you for your presentation, and he asks, oh no, he's just asking if the slides will be available in English. Yes, well, yes, I was answering to that. Well, almost all the content is available in chapter 15. So I'm going to put in the chat the link to this chapter in English where they can find this information. So without having my presentation or my slides, there's very few information in my slides that is not coming from this chapter. And in the chapter, you will be able to find all the information much more in detail. If the slides are the ones that you want in English, I will be happy to translate them. But I don't know if you are interested in my slides. I guess you're more interested in the technical aspects, and those you'll find in chapter 15. So Dr. Hein Joseph, who is the CVO from Haiti, is congratulating all the organizations for these initiatives. So with that, we will conclude. Carmen, with your presentation. Thank you so very much for your collaboration. You've been with us for 2 events, and maybe we'll ask you for some more. So if you need to step out or step away right now, please go ahead. Otherwise, we would be more than happy to have you for the remaining of the event. Thank you. Thank you. It's been a great pleasure. Now, to continue with today's event, we're going to continue with the second topic, which would be the experience of Sardinia, Italy, in the case of ASF legislation. In this case, we're going to have 2 experts, 2 presenters, who will be talking about this. The first will be Dr. Francesco Feliciani. He has as his education.
Thank you. Thank you, everybody.
So I'm going to introduce you first, Dr. Feliciani.
Okay.
I'm going to introduce you first.
Of course.
So he has a degree in veterinary medicine from Perugia University, and he also has a postgraduate degree in veterinary public health from this same university. His current position is as director at interim of the virology department of the Institute Prophylactic de Lumbria delle Marci in Togo Rosati. He is also head of the Italian Reference Laboratory for Classical and African Swine Fever and of the Italian Reference Laboratory for Ruminant Retroviruses. Among his main experiences and qualifications, Dr. Feliciani is an expert scientist in epidemiology with experience in the implementation of surveillance, control, and eradication plans for notifiable infectious diseases of livestock. but he also has good experience in veterinary diagnostics and laboratory investigations. He has worked in the virology laboratory and the veterinary epidemiology unit. He's been included in the national expert group for the emergence of infectious diseases of livestock, Italy. He's also the author of about 130 publications, including papers, oral communications, and posters. And that would be the presentation by Dr. Francesco Feliciani. Once you conclude, I will introduce Dr. Sandro Rulesu. Go ahead, Dr. Feliciani.
Thank you. Thank you very much for this presentation and also for this opportunity to talk about our Italian approach to fight the presence of African swine fever. I will try to share my screen. Please give me a feedback. It's
Perfecto,
okay.
lo vemos.
Okay.
Yes, we can. Thank you.
Yes, of course, we have a very short presentation about the Italian strategies, but it's necessary to focalize some points in my point of view. First of all, I would like to introduce that Italian regulation is included in the European Union regulation. So the rules about the fighting of in general animal diseases and in specific the African swine fever is linked to the rules that are present in European Union. Recently, the regulation 429 of 2016 complete really a great innovation in the legislation of Europe, and a specific topic about African swine fever are present in all the rules that are connected with this animal health law. In particular, I would also recommend another rule that is a working document regarding the strategic approach to the management of African swine fever. This is a really an important document that include domestic and wild pigs instruments to fight the presence of African swine fever. In Italy, we have also an Italian veterinary contingency plan that in general treat about emergency diseases. But we also have a specific legislation about African and classical swine fever, which is the European and Italian approach. There is a chain of command that began at national level with the Central Crisis Unit. This unit is coordinated by the Ministry of Health, and also are included my lab, the National Reference Laboratory for African swine fever, the National Group of Experts, especially regarding the question of wild boar problems to African swine fever, and also the regional authorities. Not every region is included in this unit, but just the region that are involved in the outbreaks of African swine fever. We also have a regional level of the fighting. This is practically as important role because it's coordinated the application of the measures included in the rules. In this unit is involved also a team of epidemiologists and the Istituto Zooprofilattico network. In Italy, we have a network of laboratories. We have 10 laboratories spread in all the country that are able to perform diagnosis about African swine fever. Of course, the last level is the local crisis unit, which of course comprehend the veterinary service, the Istituto Zooprofilattico, and a lot of police, rangers, and so on. This level has the rule to effort in practice the measures to fight the African swine fever. This is a schema regarding the eventual inclusion of an animal disease, and in particular African swine fever, the roles of the national levels with the National Reference Laboratory and the Ministry of Health, and the local with the veterinary service. Of course, we have different phases regarding the inclusion of a disease, and different rules are assigned to the different levels of command chain. As I mentioned before, we have two different contingency plans for domestic pigs and wild boar. This is very important because, as you probably know, currently in Europe, the main problem regarding the African swine fever is linked to wild boar, because the disease is persistent in a large part of this population around Europe. In Italy, we have two different plans: a surveillance plan in the free territories and eradication plan in the affected territories. As you see in this slide, practically all the regions in Italy are obliged to make a deep surveillance regarding African swine fever, but of course in the area where the disease is present, rule more impressive and active are linked to the eradication plan. We also have a very smart informative system which regards not only surveillance activities, but even the notification of outbreaks. In this slide, you can see a summary of activities of the National Surveillance Plan. There is a dashboard that, and we also have very updated data regarding all the regions. A great attention we put in the communication and in the rules of surveillance and eradication plan are assigned rules about the communication in the information of stakeholders. These are plight that are distributed in all the country regarding the risk of African swine fever. We also made the preparation about the inclusion of African swine fever virus. We performed 3 different simulation exercises in the last years. The first one in domestic pig, the second one in wild boar, and the third one in 2012 was performed simulation exercise, a larger simulation exercise regarding domestic and wild pigs. Especially our attention was linked to the measures of containment of population of wild boar, because this is the main problem that we have to front. Some news about the recent incursion of the virus. This is a map and the dashboard of the informative system regarding the outbreaks in the northwest Italy. These outbreaks start in January and involved the 2 regions, Liguria region and Piedmont region. The area is interested is a very deep wild area, and a lot of cases regarding wild boar were registered. The eradication strategy is shown in this picture. You can see that there is a core area that is contained by two or different motorway. But this containment was not sufficient. In fact, we registered some cases out of this first barrier. So our idea was to build another fence around the motorway to contain the cases of African swine fever. And you can see the area 4, 5, and 6 in the west part, and the area 2 and 3 in the east part. These are the very important containment by fences. You can see these fences to avoid the spread of the disease, and also to avoid that not infected wild boar come in the will come in the infected area. Of course, the surveillance activity is ongoing, and by volunteers, and also veterinary service and rangers and so on. This is a very difficult effort. The awareness campaign, of course, is increased in the recently year. But even in the central part of Italy, we had some outbreaks. You can see in this slide. The first one is very included in Roma urban area, and we registered 41 cases and one in a domestic pig farm. Of course, we had to apply the measures in a larger area that comprehend a urban area included in Rome town, but also in a large part around Rome. And these are in compliance with the European Union legislation. In this slide, you can see how was the dynamic of the infection. At the beginning, we define an infected area, but later we have to enlarge this area, including a large part of the territory. Even in this part, we have a motorway that is able to contain the population, but we also build a fence to reinforce the containment of this motorway. Very strange cases, but not far from Rome. We registered just one case in a common province of Rieti. No more cases were found, and we hope that this is an epiphenomenon, but we also reinforced the surveillance in this area that you can see in this slide. Of course, even in this part, we found a lot of carcasses, but we didn't find more cases. In this picture, you can see the territory, high mountain, a lot of woods, and the index case was very close to another urban area. So this is the end of my short presentation. I hope that my information was useful for you, but of course I'm available to answer to any question later. Thank you very much once more for this opportunity.
Muchas gracias, Dr. Feliciani.
Thank you very much, Dr. Feliciani. Excellent presentation. The questions will be left for the end, okay? And now we will give the floor to Dr. Sandro. Dr. Sandro will also be discussing the experience that they had in Sardinia. Dr. Sandro Rolesu in his work experience. Ever since the year 2000, he's been an assistant professor in the University of Sassari in Vienna, and specializing in epidemiology, infectious diseases, and pathology, and infectious diseases in animals. Since 2000, he has been the chief of the Center for Epidemiological Surveillance in the Veterinary Observatory of the Zooprophylactic Experimental Institute of Sardinia. And he has been a public authority, worked as the director of institutional affairs. Furthermore, since 2003 until 2024, he served and will continue to serve as the director of the epidemiological laboratory of the institute mentioned before in Sardinia as a public health authority. And also since 2003 to date, he is the head of the Center for Epidemiological Surveillance of the observatory. Of course, Dr. Sandro Rolesu, this is only a few of the highlights of his vast experience of the past few years. And he will also be referring to the experience in Sardinia with ASF. So you have the floor. Go ahead.
Okay. Hello, everyone. Thank you for your invitation. My name is Sandro Rolesu, and I am currently the head director of the Istituto Zooprofilattico Sperimentale della Sardegna. And I have been appointed since May 2021 as scientific manager of the project unit for the eradication of African swine fever in Sardinia. The object of my speech today is focused in updating you on the state of the art of the epidemiological situation of African swine fever in Sardinia by taking advantage of some hints of the legislation that since 2015 has allowed our region to practically eradicate African swine fever. So I will do some hints both on the epidemiological situation and on the strategies that have been adopted in Sardinia. The next, okay. Sardinia is currently included, according to the European legislation, in the restricted zone 3, but the last outbreak with the viral genome was found in September 2018. While the latest viral finding in wild pig population bred illegally dates back to the January 2019 in the central part of Sardinia. And no wild-boar virus positive found by passive surveillance since April 2019. Oops. First of all, let's take a look at the history of the African swine fever in Sardinia. African swine fever in Sardinia arrived in 1978 in a farm in the southern Sardinia. The viral genotype that has affected in Sardinia since 1978 is genotype 1, the same one that affected Europe and Americas from 1915 to 19. The area of Sardinia that in this period allowed the establishment of a classic endemism is the central eastern area of the island, characterized by a massive presence of oak woods and therefore rich in accords. which have always been the favorite food of wild boars, but also pig reared in the wild or semi-wild way. Precisely this characteristic related to the area has meant that since 1978, an epidemiological short circuit was established between wild animals and animals raised on rational farms, which has in fact prevented eradication up to now. It is good to specify that they are free pig populations involved in the epidemiological cycle of African swine fever in Sardinia. They are the domestic animals, animals raised in the illegal wild state, and wild boar. The domestic population represents a negligible number of heads. We are talking about a number below 200 heads in about 40,000 farms, most of which are family type, while only 3–4% of animals is raised in rational pig farms. Then we have a few hundred pigs raised in the wild states, actually few dozen. By now we are dealing with residual pockets of animals which are semi-wild and which are the object of our observation activity and the consequent depopulation. In addition to this, there are...
Dr. Rolesu,
Dr. Rolesu, I apologize. There's some problem with your audio. I don't know if you can come closer because it comes and goes. So maybe you can come closer to the microphone, please.
But now they are, in addition of this, there are, is better? In addition to this, there are about...
Mucho mejor.
Yes, better, thank
you. To be present in Sardinia, concentrated in 1/3 of the territory. Okay. This is the description of the pig population reared in Sardinia before the action of the 2015 extraordinary plan and the prohibition of wild grazing issues in 2005. We have backyard farms, 19%. In almost every rural context, a pig is held whose destiny is fattening, named sumannale in Sardinian language, and slaughtered usually in winter. In the case of sows, they can usually produce 2 or 3 liters of piglets for only for family consumption. Another classification is the confined free-ranging, 5–6%. The animals are raised with the freedom of movements, but within containment fences. Another typology, the very problem, is the brado pigs. The animals are raised with the freedom of movements without any containments. Intensive is only 1–2%, breeding aimed at producing fatty pigs for slaughter. High level of biosecurity is developed and maintained in these farms. The presence of the population raised in the wild, brado pigs, therefore able to come into contact with the wild boars that with other domestic populations has determined the conditions for the creation of an epidemiological short circuit that can be avoided by isolation the populations or eliminating one, like a wild depopulation. Okay. From 78 to now, and in particular in the last decade, we have observed more than an epidemic wave in the years 2012 and 12, which have then followed by a plateau phase with a further increase following the eradication initiatives. But as you can see, the two classifications of classes of case type, domestic and wild, are characterized by an increase in wild case due to the new classification of seropositive case as positive in the case in the wild. However, we observed then from 2019 to date, there are no longer viral isolation in populations not domestic one, neither wild, nor in the part one mentioned earlier. For example, the epidemiological short circuit that represents the critical element for the eradication activity. Since 2017, it has been the subject of an intense depopulation campaign and with subsequent serological and virological checks. This table summarized the cases of slaughtered and seropositive animals and positive virus. We note that there is a very interesting decreasing trend. Currently, we no longer observe either positivity or in new or in a few dozen residual animals. We no longer observe the presence of virus in this population. And for this reason, we are convinced that the disease has been eradicated. This you can see in this map, where the territory of Sardinia is represented with all detection stationed by the Corpo Forestale, of the animals raised in the wild that are precisely checked daily. We observe that about all the municipality of Sardinia are monitored daily with exist represented. Based on this sighting during these missions, we are able to understand whether or not there is the presence of illegal wild grazing. The characteristic of the eradication plan put in place from 2015 to today is fundamentally based on surveillance activities and in the free target population mentioned above. The main surveillance is the active surveillance in the farms, and which is based on the periodic visits of each farm to verify the maintenance of the high standard of health and biosecurity. And on the basis of these checks, which are summarized in a checklist that is administered by care of the official veterinarians, we can classify Sardinian farms into two types: certified farms and controlled farms. Certified farms are the farms that have passed all checks, so all parameters are favorable, while the controlled farms are farms that have certainly passed clinical checks and laboratory test, but have one or more parameters, for example, of biosecurity of management of the animal registration, that are not favorable, for which there is a need precisely to put end to the managerial aspects and to remedy them. The frequency of these checks on which the surveillance activity is based are managed on the basis of the risk assessment. that was carried out by the Epidemiological Observatory and is basically based on 5 levels of risk. These risk levels are increasing from 1 to 5 and are represented, we will see it later in the map, according to the territorial risk. The controls are more or less constant. We go from controls every 2 years in the territories with the lowest risk up to controls periodically to be done every year. In the most areas, in the areas most at risk, in these areas most at risk, rechecks of the checklist are made precisely in all the forms on the basis of what the risk assessment is carried out. Is evaluated precisely on the basis of 5 major categories of indicators that in fact contrast with each other. And one, on the one hand, those in green are represented precisely the protective factors, while in red are the risk factors. On the balance of these 2 elements in each municipality, the elementary index is finally produced, which determines the rank point from which that we have common, therefore that the aspect related to biosecurity and therefore the respect of the elements of biosecurity and the elements of compliance, meaning by this the adherence of the controls carried out in the farm with those there are the rules on the plan. While those on the risk factors, instead they are the presence of signs of disease, for example, in the wild population or in domestic population like seropositivity themselves, and here above all the presence of the population raising in the legal wild state. That is the more important risk factor. Obviously, this was initially shown here, the map on the initial period compared to the last period of the eradication, where the territories were slowly reclassified on the basis of the action carried out, and note that the municipalities, let's say the municipality that have decreased the level of the risk, that has now been reduced in the area that you see circled in the darker color, and where the municipalities that are still to be cleaned are represented, because they are not yet totally free of residual risk factors. But we have created a new approach as for the surveillance activity. We have been going in the recent years, we have been checking more and more. We have an ever increasing number of farms that go from controlled classification to the certified classification, which improve the health status. This is a new, in this map, we show that this is a new representation of an approach based no longer on the classification only in the territorial risk, compared to the previous plan. Is characterized precisely by a classification of the risk based mainly on the type of farm. Therefore, each farm is classified both on the basis of the territorial risk to which it belongs, but also on the level of risk farm. The farm is precisely evaluated on the basis of the check carried out in each farm. What are the rules? So we have a gradient color that are increasing from green to blue or red, where are therefore able to define the specific risk directly at the level of each farm on the basis of an mathematical algorithm that is periodically checked by the epidemiological observatory. In each of these farms will be checked precisely on the basis of the finding of this control. Therefore, each veterinary service receives an indication on the basis of which they will carry out checks. Surveillance is therefore based both on the farms but also for the risk of the territory. The surveillance of the wild is more different because we have active surveillance and passive surveillance. The active surveillance is basically the control of the animals hunted during the hunting campaign that starts in Sardinia in November and ends in January, and is carried out in the red zone, so-called infected zone, where 100% of the hunted wild boar is controlled, while in the zone outside the infected zone, it is controlled a significant sample of animals. Alongside this active hunting surveillance, which we recall can only be carried out on the basis of an authorization within the infected area. While as regards passive surveillance, it is carried out throughout inter-year. Passive surveillance is based on the finding of carcasses of dead animals found precisely in the geolocalized in the territory. Let's say that these are also a dead check carried out on the occasion of road accidents. Sorry. All this feedback can be monitored by us through the information system specific, which is the synthesis of all the information system present in Italy. And this the so-called data warehouse. In this data warehouse, we collect data relating to the domestic and the wild surveillance activity and the controls of animals raised in the wild and the represented of outbreaks. This is an example of the screenshot of this data warehouse. Okay. I think that is better. Oh. Let's go a little further because obviously there will not the possibility to check what we are interested in underlying. At the end, it is relative to the application in Sardinian of the content of a contest referred to the exit strategy by EFSA document of 2021. We have the possibility of representing that the data necessary for the exit strategy envisaged by we have already reached the number needed to be able to declare the region of Sardinia free from infection. This obviously still needs to be monitored with regard to the last month of this year, and we are persuaded that we will arrive at the beginning of the next year, or at the end of this year, to finally be able to declare, by applying this approach based on the exit strategy, that in Sardinia, the African swine fever virus has also been eradicated in wild population in such a way that we can demonstrate and that we can once again allow our region to pass to a different classification so that we can finally resume trade in our products. This one last slide where I show that that in fact we are also applying a new way of represented passive surveillance by using an application that you see in this slide, or another type of tool is based on the use of molecular dogs for the active search of carcasses. This is the data warehouse. Finally, we have created, in order to have a rationalization of everything that we are precisely telling, an operating manual where all the contents of the eradication plan are represented with all the procedures that are put in place in Sardinia. For those who want to go in depth, can be distributed the operating manual. Thank you for your attention and see you.
Muchísimas gracias, doctor Rolesu.
Thank you very much, Dr. Rolesu. I don't know if you can talk briefly about the updates, the changes, and the developments of the legislation in your entire experience to be able to attain all this surveillance and this response to the PPA emergency, to be able to attain this operational manual and the whole thing. Maybe you can talk briefly about your experience in Sardinia.
Our experience is very it's changed from 2015 when we create a specific project unit. A project unit is the new organization of the legal authorities. We have one coordinator that represents the president of the region in all authorities. This, in my opinion, this is the more important goal of the eradication plan, because reduce more the chain of command. Only in this phase we have the possibility to improve our actions. For example, the population the population for this pig populations like brado pigs that are the more important problem, because there are many social problems, because the type of the typology of the breed is strictly related to the traditional for the tradition, and the people are not come si dice, are not happy to modify our traditional kind of relation, because the transformation of this kind of type of breeder in a rational type, if in a sanitary point of view is miscomprehensible, but in terms of and the new Green Deal, for example, the new point of view of the international legislation, like the possibility to utilize the habitat in complete type is possible only if we eradicate the virus, because if you don't separe, not only physically with the fences, but with the biosecurity, in my opinion, the mental biosecurity, not only by biosecurity physically.
Perfecto, doctor. Excelente.
Thank you, doctor.
I would like to add some comments.
Yes, please go ahead.
About the question represented by Sandro. I would like to share with you the question that in the past, the European legislation was focused in big domestic pig farms. Rules of biosecurity, the approach for the eradication of a disease were tailored about the big farm of pigs. But currently in Europe, we have to front a different situation, because the main problem, as I mentioned, is the presence and not better, the persistence of ASF in wild boar population. Moreover, we have a lot of small pig farms that has a lot of problem in biosecurity and a lot of connection that is favoring the spread of the disease. So the European approach to and the strategy to fight the disease had to move to a completely different approach. And probably in Sardinia, we anticipate this revolution, even because in Sardinia, there was also the problem of illegal free-range pig. So I believe that the legislation is very important, but should be dynamic and have to take in account the environmental condition and the environmental context, and also the connection between farms and the type of farms. So we have to take in mind, of course, in our legislation, the virus, the dynamic of infection, but also to consider the type of farms and the wild boar context. In Sardinia, probably we have a good model about this legislation, that because there is a regional legislation that is able to overline the European rules and the regional context. So it's very important to take in account of the social context where the disease is present. Thank you.
Thank you, Francesca. I completely agree with you.
Gracias a los dos.
Well, thank you both for elaborating on this topic that you just presented. There are a number of questions in the chat room, but we will leave them for the end. We are going to continue with the third part of our event. And in the end, we'll ask the questions that we have for you and for the US. So now I will be introducing the next presentation, which has to do with the experience of the United States in the developing of ASF legislation. And the first presentation will be carried out by Dr. Jonathan Sack, who works for the USDA. He will be talking about the legislation and the regulations that exist nowadays that facilitate the prevention and response to an outbreak of African swine fever in the United States. Now, briefly about Dr. Jonathan Sack. He graduated in 1997 from the University of Minnesota College of Veterinary Medicine. He was a large animal and equine practitioner prior to joining the Animal and Plant Health Inspection Service in the Veterinary Services in 2002. He also joined the Animal and Plant Health Inspection Service, and he has worked as a veterinary medical officer of the district in the area. And right now, he is the director of the National Preparedness and Incident Coordination. His preparedness activities include safe food supply plans and the Foreign Animal Disease Preparedness and Response Plan. Its response activities include exotic Newcastle disease, contagious equine metritis, the malignant catarrhal fever, the low prevalence avian influenza, the high prevalence avian influenza, and the screwworm. And with without further ado, we'll have the presentation by Dr. Sack.
Thank you, Erica. Thank you all for the opportunity to participate today. It is very constructive for us to collaborate on African swine fever, a disease that impacts many currently and that threatens us all. In the United States, talking about how to develop legislation, policies, set goals. We make those publicly available on our FADPrep website. And a lot of the material I'm covering today is in what we call our Manual 1, which is our FAD framework for roles and coordination here at the USDA. So if anybody's interested in depth, they can check out, these materials. For us, fortunately, African swine fever is pre-identified as a foreign animal disease. I know over the years that we use terms like transboundary diseases, emerging diseases, and they're all good constructs, useful constructs.
Dr. Francesco, your microphone is on.
So thank you. So
please go ahead. Sorry.
So for us, that we have a spectrum of diseases that are pre-identified that if we detect them here in the United States, we're good to go on a hair trigger, which I think is very important because I think the lesson learned about emerging disease and transboundary diseases is that you can worry about them and you can wring your hands about them. But if you end up something with like Seneca Valley virus or swine enteric coronavirus disease, emerging diseases that impact livestock or poultry in the industry, if it's not identified as a regulatory emergency intervention go, then it becomes a bit problematic to sort out, well, what are we going to do with it? So I think the lesson we learned is there will be diseases that we respond to in a regulatory fashion, and there will be diseases that we do not respond to in a regulatory fashion. And you may not know if an emerging disease is necessarily going to be responded to in a regulatory fashion, but to the degree that you can identify those ahead of time, I think that's a big lesson learned, for us here in the United States. When you talk about establishing legislation and reviewing authorities, from our perspective, really, at the end of the day, from top to bottom, from start to finish, you need to have a line of sight on practical outcomes. And practical outcomes are that, legislation on paper is just that, legislation on paper. But how do you translate, federal laws and legislation, state laws and legislation, private sector industry expectations and capabilities into a unified response? So, we've bookmarked these as, if you're gonna either, exclude something from your country or respond to something in your country, you have to think again practically in terms of what are the roles and responsibility of all the participants. Jeff Kaizen, the state veterinarian for Iowa, he has a great phrasing that I steal and borrow, that there's a triangle of triumph or a triangle of turmoil. And the triangle of triumph is when the federal government, the state government, and the private sector entities all collaborate and cooperate and push and pull at the same time on a unified response or a unified objective. And that is, kind of a highfalutin or highfalutin esoteric goal. But the reality is, for any type of actual disease exclusion or response, it needs to include local, state, private sector entities and the federal authorities. So here, I think, is just a list of some practical things that we try to achieve. Just something simple as ensuring that there are clearly defined, obtainable, unified goals. Ensuring all guidelines, strategies, and procedures are communicated not only to the regulatory officials, but to the responders and the stakeholders at the company level. So I think that you have to start with, obviously, authority and legislation, but the hard job is working together to actually be able to implement it and implement it effectively and efficiently. For the USDA, our primary legislative authority or great question authority is through the Animal Health Protection Act, which is part of the US Code, which is the laws directly passed by Congress. And then our secondary regulations or laws, which basically are published by the USDA Federal Executive Agency, is the Code of Federal Regulations. So our big, broad sword and shield is the United States Code Animal Health Protection Act. Again, that's the will of Congress. And then we have the Code of Federal Regulations from the USDA Department. And that includes some of the relevant sections here for focusing on response. That would be the USDA Secretary Authorities, delegation of authorities to APHIS, the indemnity and compensation for foreign animal diseases, regulation for interstate commerce, in our National Veterinary Accreditation Program. The Animal Health Protection Act really provides very strong, broad authorities. And I think that here in the United States, we're lucky because politically, agriculture impacts almost every state, so that we have a lot of unified, not only state departments of agriculture, but politically, we enjoy Congress has given the USDA broad authorities to help support the states with their exclusion and responses to foreign animal diseases. Some of these broad authorities include the ability to inspect without warrant persons or conveyance moving regulated animals or articles in the United States, the interstate commerce or interstate commerce, the ability to declare an extraordinary emergency if necessary. And a big thing is to transfer funds from other USDA agencies to basically directly respond to any emergency or threat. That funding aspect is really critical because the USDA needs to fund its own direct personnel and equipment for response. We need to support the state's departments of agriculture and their response. And as other speakers have said very eloquently, you need to provide indemnity and compensation for the producers directly impacted by animal disease. Here in the United States, if there's a taking by the state and federal government, there is indemnity for the animals and the germplasm taken. We also provide compensation for direct costs for depopulation efforts required, disposal efforts required, and virus elimination, reasonable virus elimination cost share to try to restore premises to non-infected infected status as we can. The USDA secretary has the ability of existing contingency fund money, the Commodity Credit Corporation. In 2015, I believe the secretary was able to take about $800 million out of that to support the response then. For our high path response this year, again, a significant amount of money, obtained from the Commodity Credit Corporation at the USDA for that response. In addition, for a much bigger outbreak, then supplemental from appropriations for Congress can be obtained. USDA is the lead federal agency for foreign animal diseases in livestock and poultry in the United States. That's just kind of a flat statement, but it basically says that at the start of any outbreak, USDA is responsible for livestock and poultry. USDA roles and responsibilities fall across a wide spectrum of activities. I think probably maybe the best way to think about some of these roles, responsibilities, and activities are what's under the umbrella of legitimate authority, such as legitimate authority being the Animal Health Protection Act and the Code of Federal Regulations. Then also referential authority. Referential authority is the ability to provide disease subject matter experts, epidemiological expertise, modeling expertise, diagnostic expertise, and the National Reference Laboratory, or National Veterinary Services Laboratory. And again, funding for, again, exclusion activities and response activities. Other roles and responsibilities are to provide work with wildlife experts. We have a wildlife services here in APHIS. because again, many of these diseases don't just impact livestock and poultry. So we have to coordinate with wildlife experts, both at the federal level and the state level, as well as coordinate on public health issues with the Federal Department of Health and Human Services. Other roles and responsibilities include conducting risk assessments, pathway assessments, as well as, more ways of modeling outcomes, and maybe the best way to apply science and risk-based approaches to both presenting diseases and responding to diseases. Again, the USDA is the lead federal agency, but we have the mechanism to request federal to federal support from other US government federal agencies. For instance, we work closely with the Department of Homeland Security, particularly the Customs and Border Protection. They work with APHIS and USDA on the, basically intercepting the illegal foods that can come through our ports, seaports, and airports, or otherwise imported. We work with Health and Human Services on zoonotic potential or other type activities that become under the One Health spectrum. We work with the Department of Interior closely for any diseases that may impact federally owned and managed land. We went through an experience with screwworm in Florida where we had to work very closely with the Department of Interior, managing the response to screwworm on federal managed lands. The Environmental Protection Agency, everything from the legislation and approval the EPA does for the disinfectants, as well as national regulations and policies regarding carcass animal disposal, as well as then the local, state and local disposal authorities. Also work with the Department of Justice. In particular, we have a memorandum of understanding with the FBI. There's a lot of concern that someday someone might try to use an animal disease virus or agent, either as a deliberate act of mischief or terrorism. And so we have the FBI federal law enforcement capability to tap into if we need to do broader criminal type investigations. We also have a relationship with the Veterinary Corps, with the Army and their expertise. When you think about legislation for responding to a disease in livestock and poultry, again, we have to worry about, well, what is going to be the exclusion, import, export regulations? What are going to be the actual disease response guidelines, strategies, goals? You can say you have a stamping out policy. We're going to do surveillance in these zones. We're going to require emergency permits in these zones. We're going to have emergency regulatory intervention control areas and containment areas established. But again, kind of goes back to, okay, you got that written on paper, how are you going to do it? And this is where I think, again, in the United States, based on the lessons learned for us over the last 20 years, responding to hurricanes, forest fires, wildfires, and other type of all hazard emergencies. In our country, we do have a national response framework, which does provide the rules and regulations for how emergency management activities are conducted. And I think that, that's an important thing because, again, when you have to pull together local authorities, state authorities, federal authorities, then you're also pulling in, well, who has the capability, including the private sector. Private sector can bring tremendous amounts of capabilities to any response. And the private sector is essentially responsible for conducting biosecurity. They have to collect samples in addition to the regulatory authorities. if you're going to have extensive surveillance campaigns. So how do you come together again for a quote unquote unified response? And the framework for that for us is our national response framework. So you have to integrate, the national laws, the state laws with the national response framework. And then, from the USDA, we provide, we provide the rules of engagement on how to deal with the virus. This is what you need to do to beat this virus. And we say we want to do contain, control, eradicate, okay? How do you do that then operationally? And how do you do that quickly, efficiently, and leverage all the capabilities that are available to you? So you don't have redundancies, you don't have confusion. Our current National Incident Coordinator for Hypathii, Corin Custer, has a great quote. She says, "Calm is contagious." So when things are getting excited or people are getting bent out of shape, Corin is very steadfast, very calm, and she'll remind everybody calm is contagious. And when I talk to Corin, we both know that calm is contagious, but confusion and chaos can be highly contagious if you let those conditions persist. So again, it comes back to not just managing laws and legislation, but managing people and systems from different entities and how to pull them together. How you do all that, pull them together, is with and here in the United States, we use the National Incident Management System, which is basically something adopted from the USDA Wildfire Service on how to scale a very small response up to a national response, and how to roll private sector entities, state government, federal government resources into your response. Again, you have to manage, when we talk about the response, first thing you have to do is manage what we talk about as off-scene players or entities. And in multi-agency coordination, you have USDA. If you have the USDA, you have the FBI, you have HHS, you have a state government, you have industry association groups. You have to establish a very clear hierarchy of, well, this is where the people that are providing policy are. This is where the people providing resources are. And then this is where the people are actually doing the operational activities. So what we try to do is, have policy and resources, basically, here's the goal, here's the direction, here's how we think you should achieve the broad goal. And then you have to turn that over to the actual incident management. And this seems like kind of an obvious thing, like any business unit, like we have somebody that designs something and then somebody has to implement something. But if you've ever been on a construction site where the architect is arguing with the engineer who's arguing with the contractor, you have some idea where you have to have clear lines of authority, such as, yes, the USDA provides the legitimate authority, the referential authority, but the states do as well, because we're operating under state authority. And the private sector companies and entities, they have to accept everything, because if they don't accept anything, then you have nothing. Then you have chaos and confusion. So we have to work very hard, both before an outbreak, during an outbreak, and after an outbreak, to try to communicate what is your command and control system? What communication systems are you going to use? And that very much involves getting into computers, where you have to do information management so that we can accurately report what's going on, as well as, which becomes a big job, the task management. And then you have task management for not only the infected prem, but you have task management for your containment areas. And then you have task management for your surveillance areas. And then you have task management for everything from, again, soup to nuts, top to bottom, start to finish. What are you doing? How are you doing it? How are you going to get it done? And, the broad categories of activities are, command control, communications, computers, planning, operations, finance, administration, logistics. And that's where our National Instrument Management System provides the hierarchy structure to get things started so we can work together and pull elements from many places. And then you have to be prepared. Well, if you have one state or one area impacted or infected, how do you scale up to have multiple states impacted or affected at one time? You all have this. You have your provinces, your districts, whatever it is. How do you manage multiple incident commands out in the field? How are you going to manage that? Are you going to have each one report directly? You're going to have a area command. So there's not one way to do this, but you just have to, again, figure out how you're going to do it. What we have here as APHIS is we provide national incident management teams, which are called command and general staff teams, which have an incident commander, a deputy, again, a finance specialist, a planning specialist, an operations specialist. We also have computer specialists, epidemiological specialists, depopulation disposal specialists. So that core team is like your advanced team that sets up your local command and control to actually conduct operations. And we have 5 colored teams here at the USDA APHIS that we can split to have 10 total teams. And we're very fortunate because having those people on call ready to go, again, it's kind of a very few, if you need a lot of people sometimes to solve a problem, but to start to solve the problem, it's good to have a core group of trained, ready, experienced people that know how to roll out and set up with the state and the private sector companies so that you can avoid the chaos and confusion that occurs at the start, of any incident or outbreak. Again, for our current ASF specific response plan, our other associated documents, such as like epidemiological investigation form, or forms for how owners and growers can request indemnity, other types things. We have those available on the web. I have to say, we've been working very hard here in the United States on African swine fever preparedness. And it is not easy because for us, we haven't had African swine fever here ever. We haven't had a regulated disease in swine since pseudorabies, which was eradicated in 2004. And that was a bit different because that was an endemic disease that got eradicated. So we've been working very closely with our states and our private sector companies across the board, like, how can we improve diagnostics? How can we improve surveillance? How can we improve our contact tracing? So all those nuts and bolts activities we're working very hard on. And, we still need to do more work. We recognize that, and we're every day, a lot of us, again, across the state, federal, and private sector are working, try to improve and get better, because we're very worried that, this might get into our country or our hemisphere outside of, Hispaniola. So, thank you again for the opportunity. And I think I used up my time, so thank you.
Muchas gracias, doctor.
Thank you very much, Dr. Jonathan. So definitely, your presentation was a very interesting one. It's a very good example of integration to solve and get prepared for ASF. Now I'm going to give the floor to Dr. Hunter. Dr. Hunter will be talking to us about the efforts to establish a protection zone. And to tell you about Dr. Hunter is to tell you that she has worked as a federal veterinarian at the United States Department of Agriculture for 15 years. Currently, she works at APHIS Veterinary Services as a trade policy advisor And she also got a BS in animal science and a PhD in veterinary medicine from Washington State University. She's also obtained her master's degree from the University of Edinburgh, Scotland. So without further ado, Dr. Hunter, the floor is yours. I believe that Dr. Jonathan needs to stop sharing his screen for Dr. Hunter to share hers. Thank you, Doctor. So in the end, we'll have the Q&A session. So don't forget to type your questions in the chat box. And while we wait for Dr. Hunter to share her screen.
All right, good afternoon, everyone. It's great to be here with you today. I'm going to share a short presentation regarding the legislative mechanisms and experience that we've had in preparing for African swine fever and setting up a protection zone in the Caribbean to prevent the incursion of African swine fever from Hispaniola. I am concentrating today on the legislative mechanisms and experience as opposed to the actual setting up of the protection zone, which is a slightly different topic. So to begin with, we're going to start someplace where you've already heard from Dr. Zach about the Animal Health Protection Act. As Dr. Zach noted, this is a law that was passed by our legislative branch of our government, the Congress, that provides broad authority to the USDA for regulating animals and their products that pose a risk to US agriculture. Now, the importance of this document for establishing a protection zone is that, as you know from the OIE, or excuse me, the World Organization for Animal Health, excuse me if I continue to call it the OIE, you know that the protection zone is implemented prior to incursion of the disease. So everything that Dr. Zach presented to you is what we do to prepare for an incursion of disease. But then there's the actual response that occurs during the incursion of a disease. And one of the things that you have to realize is if a protection zone is there before you get that disease. So you're implementing a response plan before you get a disease. You're implementing a plan that basically is for surveillance and to respond to pathways which could allow the disease to move into your boundaries. So the first thing we had to do is make sure that our overarching law would allow us to implement requirements in the absence of a disease on our interstate commerce. So we already have the authority under this act to prevent the incursion of disease in the United States from imported goods. But we had to, generally we don't implement restrictions on interstate commerce unless the disease is actually occurring. With the implementation of the protection zone, we did the opposite. We implemented requirements and restrictions within our protection zone on interstate commerce before the existence of a disease in order to prevent it. So when we went back to our overarching law, we found a couple places where we had that authority. And as you can see in this highlighted section, it talks about interstate commerce and foreign commerce in the United States in animals and other articles. And then if we go down further, it talks about the health of animals is affected by the methods which animals and articles are transported in interstate commerce and foreign commerce. It talks about all animals and articles regulated under this subtitle are in or affect interstate commerce or foreign commerce, and that regulation by the Secretary and cooperation by the Secretary with foreign countries, our own domestic states or other jurisdictions or persons are necessary, and then says to regulate effectively interstate commerce and foreign commerce. So it's very important that your overarching laws allow you to legislate for your own domestic movements. If we don't have that, then you don't have the laws necessary to implement a protection zone. And we looked carefully at this law and we found that we did have that already written. And so we did not have to go back to our Congress and ask for that to be part of our mission statement or part of our Animal Health Protection Act. So once you move from the Animal Health Protection Act which is our overarching law, providing the Secretary of Agriculture the general authority to perform the activities necessary to ensure that the articles described within the act are achieved. As Dr. Zach mentioned, the next level down from that is what we call the Federal Register. And this is an official journal of the federal government of the United States. It contains all the government agency rules, proposed rules, and public notices. So anytime the United States Department of Agriculture has to implement a new rule or a public notice, it has to be published in the Federal Register. So that's the first place it goes. Once it's published there, and we have went through all the proper legal requirements for finalizing the rule, and the rule becomes permanent, or at least finalized in whatever time frame is mentioned by the rule, then it has to be written in our Code of Federal Regulations. And that's the codification of the general and permanent regulations published in the Federal Register by the executive departments and the agencies of the federal government of the United States. So that's where you can find all of our regulations that we talk about written down in more detail, and the exact requirements for doing a specific action, or what actions are going to be taken to prevent incursion of a specific disease. So it's a cascading effect by which you start out very general, and then you move into more and more detail as you move down through these different journals and codifications. So the federal order is a legal document issued when the administrator of APHIS, in this case, because APHIS is part of the USDA, but APHIS is the part of the USDA that deals with imports and exports and foreign animal disease incursions, along with partners that Dr. Zach has described. So the federal order is a legal document issued when our administrator considers it necessary to take immediate action to protect agriculture or prevent the entry and establish of a disease into the United States. So it's kind of an emergency style declaration that's what a federal order is. And that federal order for ASF was implemented in December of 2001. The initial one was in, I want to say September, but don't quote me on the first date. And then we revised it on December 2nd of 2021. So you can see the number of the federal order, the date it was implemented, the subject, and who it was to. Those all go into the federal order, which goes into the Federal Register. And that way it can be published as a permanent law, or whatever time frame is set by the federal order. Not all of them are permanent, but it allows us then to implement the parts of the Animal Health Protection Act that we are working under in order to establish the ASF protection zone. Now, the zone is established per OIE requirements, but of course we have to ensure that in the United States we have all the legal authority necessary to do that, and have undergone all the legal requirements in order to implement these restrictions on interstate commerce in the absence of a disease. So once you have the federal order published, then you have to let your public know that you have implemented these new requirements. So we do that through what we call stakeholder alerts. Some of those alerts go out in what we call intergovernmental channels, which go out to our trade, the internal partners that Dr. Zach described, and also additional partners like our Customs and Border Protection, so that they all know what their role is in this new federal order, and they know what it says and what it's about. We help them explain it to their employees, and if they have jobs that they need to do in order to implement the federal order, then we work with them to explain exactly what that is and how to implement it. We also send a stakeholder alert out to our public, the US public, so that they understand what is going on, why it is happening, and what the concern is, particularly because this affected our public within the protection zone, which is made up of the US Virgin Islands and Puerto Rico. We definitely wanted our public to understand what was going on and why it was happening, and give them deadlines for when certain things were going to happen. Once we send out the stakeholder alerts and get everyone prepared, we also provide guidelines that we publish on our public-facing website that explain the order or the rule and explain what people who want to work within that rule and still be able to move pork and pork products and live swine and swine products within or out of the protection zone. We put that in a guideline and we publish it on our website with additional information on how they can contact us if they have more questions. We'll also prepare talking points for our leadership, both internally, again, to our government partners, and externally to our public, and also to our trade partners who also want to know, how we implemented this protection zone, how is it going to affect them, and what is it that they can expect from the United States once it is implemented. We'll create frequently asked questions, again, to put out publicly and share with our partners. And also, finally, we do traveler information, which is generally web-based, but in the case of the protection zone, we also provided these as placards in airports and also as radio announcements within the protection zone. So that's really an overarching view of what needs to be done from a law perspective, from a legislative perspective, to implement a protection zone. Again, I'm not going to get into the details of the protection zone itself. We would be happy to share that information, but I felt that that was outside of the particular request for this presentation. So with that, I'll take any questions.
Muchísimas gracias, doctora Hunter. Ahora vamos a continuar
to the questions and answers and comments. Really excellent presentations today. I would only like to point out that other countries have indicated their presence: Panama, Paraguay, Guatemala, Venezuela, Colombia. The Committee of Support in Veracruz in Mexico, they send their regards. The Ministry of Agriculture, Livestock and Supply of Brazil, Peruvian Association, the Pig Farmers Association of Argentina. So we do have a wide range of participants. So let's move on to the questions and answers now. Everything has been extremely interesting. So the first question that had been asked, how to access the manual for ASF that was mentioned by Sandro and Francesco. I think they have, Dr. Francesco has included the link in the chat, so you can find the document there. Another question for Sandro and Francesco. They're asking, what recommendations could you share for the countries that are developing their legislation for ASF, which are in the process of developing it? What are the first steps? What are your recommendations as first steps to follow this road? Thank you. It can be Francesco or Sandro, whoever prefers. Thank you.
It's quite a very comprehensive question. It's very large. Okay. First of all, avoid the incursion of a virus, I believe. It's really important, the biosecurity measures. Unfortunately, we have a strong legislation in Europe about the eradication of a disease, but our legislation is quite not comprehensive about the prevention. Prevention is very important, and the first measures, the first thing about prevention is biosecurity. Even biosecurity, it's really important not to pay attention just for domestic pigs and of course domestic farm, but biosecurity is really very important even in wild boar. For instance, in my country, probably in Rome, the virus arrived arrived to wild-boar population of Rome by waste deriving from people. So a legislation about waste and as a possible origin of outbreaks of African swine fever is, in my opinion, is really important to provide. Moreover, another important point, in my opinion, is we have two models about the eradication of African swine fever in wild boar. The model are successfully experienced by Belgium and Czech Republic, but is limited to a small cluster of disease. Actually, we have a large population with a persistent infection of African swine fever. So we have to find a solution for these large outbreaks of a disease. In the past, me and Sandro discussed about the problem is that African swine fever is not only an epidemic disease, but even an endemic disease. In Sardinia, we had to front an endemic front about African swine fever. So we have to forgot the problem about epidemic emergency. Not forgot. We have to front, of course, the eventual occurrence of epidemic incursion of a disease, but we also to be prepared to front epidemic persistence of a disease. I believe that the Italian model could be followed about even another part of the world. And as I mentioned before, it's important to tailor the measures in the context. Probably the virus is the same. We have we know that African swine fever is a very stable virus. The virus is practically the same that arrived in Georgia and now is in 5 continents. The virus is the same, but the pigs sector is different around the world, and even while suites are different around the world. So we have to tailor our rules in the context where the disease is present, is possible to be present, and is possible to arrive.
Excelente, doctor Francesco. Muchísimas gracias.
Thank you, Dr. Feliciani. Thank you very much for these recommendations. Let's continue with the questions. Go ahead. Sorry, I cannot see you here with all the screens. Go ahead.
I completely agree with Francesco, and I think that the model with you fight with African swine fever is very characteristic in terms of your capacity to analyze in deep your territory. Your territory separate your observation in 3 or more scenarios. The first of these scenarios is the pig breeders. The pig breeders generally is very proactive with and work ensemble, work with the authorities. But it's very, very important to make the tables with the round tables with the stakeholders, people that have many that know the habitat, the territory situation, because the problem is the transformation, an epidemic situation that is resolved generally in 1 month with the population of the pig with an outbreak. But if unfortunately the African swine fever plays an endemism, this as the bad situation. We have passed 40 years with this problem. Sorry.
Perfecto, doctor Sandro. Muchísimas gracias.
Thank you very much, Sandro. Thank you very much for answering this question. I think that with all of the experience that you've had and this model that you've developed is very, very important. And it's very important to know about these tools that have been used in other countries and other continents to adapt them to our hemisphere and our region. Thank you. Continuing now with the questions. We have for the United States a question for Dr. Zach or Dr. Hunter. The following question. Which have been the main challenges when designing standards or regulatory procedures for ASF or other transborder diseases? Dr. Zach or Dr. Hunter?
Dawn, I can go first, if that's okay.
Yes, please do.
I mean, it's a great question. And I think for us, the biggest thing, the hardest thing to get around is that, you know, right now we currently enjoy ASF disease-free status, foot and mouth disease-free status, and classical swine fever free disease status, which means that in any given day, you know, we have about 500,000, you know, in any given week, about 2.5 million pigs are being, you know, harvested at slaughter establishments each week in the United States. So when you look at the daily operational tempo for swine production and swine harvesting or slaughter, it's kind of a mind-boggling continuity of business operation. So when your day-to-day, you know, standard is, you know, we enjoy a disease-free status, we have, you know, exclusion regulations, we do have other swine regulations for swine health, interstate commerce, Swine Health Protection Act, garbage feeding regulations for the states that provide garbage feeding. We have foreign animal disease investigations. I mean, we do about 2,000 investigations a year for Seneca Valley to rule it out as FMD. But really the biggest hardship is going from a very high tempo, both swine production and swine slaughtering, with very complex interstate commerce activities going on. I think everybody is just kind of hung up with the, oh no, if we have African swine fever, we know we're going to have a domestic, I mean, we're going to have an international trade impact immediately. But then how do we manage the interstate commerce issues? And so, you know, working with our stakeholder states, the swine companies, both the production companies and the slaughter companies, you know, how are you actually going to establish the containment zones? Are we going to do a national movement standstill? How are we going to start up, you know, the concept of containment areas and free areas? How are we going to do the surveillance on the control areas, containment areas? How can we do broader surveillance in the free areas? So I know everybody here in the United States is going to be very interested in restoring international trade as soon as we can. But our first hardship is going to be how to manage the domestic response and all the complications to interstate commerce. So I think that we have enjoyed ASF-free disease status, which is great. But we know that the day, if we get it, there's going to be drastic change needed in terms of emergency regulatory response, and then getting, again, the states, USDA, other federal departments, and the private sector companies to efficiently and effectively agree and respond. And I think a lot of it is driven by the scenarios. Is it in feral pigs? Is it in domestic pigs? Is it in both feral and domestic pigs? I think the hardship is the uncertainty that people feel, and how do you, get rid of that uncertainty for what response will be and what the path forward is.
All right, thank you, Dr. Zach. I'll just add to that, and I think this is a shorter version of where Dr. Zach was going, but you have to use care when you're creating policies that you can actually implement those policies. And you're going to need the cooperation of all of your stakeholders, internal, external, government stakeholders, industry, slaughter facilities, other secondary facilities that process products. If you don't have their feedback and input and agreement on what you are going to implement, then it's not going to work. While our administrator and our secretary have the authority to create an emergency declaration and put into law any declaration that is necessary to protect American agriculture, if we don't have the agreement to cooperate from all of these stakeholders, implementation is impossible. So you have to make sure you have that. Then you have to make sure that what you're trying to do is possible. So for instance, when we implement new restrictions or requirements on interstate commerce, we had to make sure that our partners in Customs and Border Protection and in our sister agency, Plant Protection and Quarantine, who runs our pre-departure program for people leaving the protection zone and coming to the mainland United States, we had to make sure that they also had the authority and the ability to implement the restrictions that we as the policy creators put in place with the federal order of the protection zone. So you have to make sure that you're not just creating policies that can't be implemented.
Thank you very, very much, Dr. Zach and Dr. Hunter. In this line, there is another question for the two of you, which reads as follows. When you think about those countries that still don't have all of the elements in place, what would you recommend for sensitive topics such as quarantines, compensations, insurance, etc.?
Yeah, I think it's hard to make a specific recommendation unless you understand the actual, country and the human terrain, the human relationships, as well as the regulatory framework that exists. But I think the biggest thing, just kind of go back to what Dawn just said, is you need the ability to get on a farm. It seems very basic, but whether you're doing an ASF investigation, a foreign animal disease investigation, or an ASF response, you need to have a state regulatory official or a federal regulatory official, however you're organized and working together. You really need to be able to get people on a farm where those owners, growers, producers will meet with you and accept with you. So again, I think, I think the legislative framework is very important, but unfortunately, a lot of this comes back to capabilities and resources, which require one, funding, and then two, you really need the industry, and each country's industry is going to be widely different. But you need the pressure from the industry that nobody wants to be quarantined. Nobody wants to be the infected premises. Nobody wants to be in a containment area with mandatory surveillance. But you have to do those things. And you need folks that can actually get on the ground, explain what needs to be done, have those folks accept it in a way that, part of that is showing them a pathway out of it. Our kind of unspoken rule is you put somebody under quarantine, you got to provide them the way out of it. Can't just be, well, you're under quarantine, we don't know what we're going to do with you. It's like, we're under quarantine. And here in the United States, we're operating under state authority, ideally. Ideally, for any animal disease response, it's the state authority doing the quarantine, and USDA APHIS is there to support the state with personnel and resources. And then federal authority is applied additionally only if it's needed. But you really need to be able to work with the producers, the companies, the industry, however you describe it, and gain their trust. And the way to gain their trust is to provide a clear path forward. And then the other part that becomes the hard part is having the resources and capabilities to implement the actions that you want to implement.
Yeah, I don't really have anything to add to that. I think we've made the point that cooperation is key here.
Muchísimas gracias a ambos por sus
Well,
respuestas.
thank you very much to both of you for your answers. Now we will take the last question, which is for Dr. Sandro and Dr. Francesco. In the case of outbreaks that take place in neighboring countries close to the border, what would be the most urgent things to consider into the legislation? Go ahead, please.
Even this is a really a big question. Of course, we are lucky because we are included in the European Union, so we have the same legislation that France or Austria, other countries that is in the border with us. Anyway, of course, it's really important, in my opinion, to have a transparent communication. For this, we also implemented a very strong informative system. We share our data with border countries and the other countries of the European Union as well. And other countries made the same. So really important is, in my opinion, is the connection between countries, even deciding the strategy. For instance, as I mentioned, in Sardinia, we not use fences for to fight the African swine fever in wild boar. Instead, in northwest Italy and in Rome cluster, we use fences. So different strategies, different contexts, but in case of different countries involved, the same strategy should be adopted. European legislation provides that a group of experts decide better, suggest the correct strategy. In case of involving of border countries, it's really important that these experts could share their opinion, can discuss the situation and find the better solution to front the situation. The animal health law that I mentioned in my presentation and that rule all the animal disease in Europe give a big importance to relevance to the risk analysis. So the experts are the best people that are able to perform a risk analysis and made a tailored strategy to front any situation. Of course, my hope is that especially the cluster in northwest Italy that is really close to French border not explode and the virus doesn't spread to the France. Better, my hope is that the cluster in northwest Italy could be solved in the next future. Anyway, there is in Europe a strict collaboration between national reference laboratories. We are strictly connected with international authorities such as OIE and EFSA. So I believe that a good strategy could be found in case of involving of different states. Unfortunately, this situation is not provided in the East Europe. We have some problem in the borders between Poland and Germany, but the experts of both countries are discussing and probably it's very close to find an agreement between these countries. Anyway, it's very complicated to find the same strategy, an adequate strategy when are involved countries included in the European Union and not member states. For instance, it's quite complicated in Europe to know the situation in Belarus. Currently, we have a war between Ukraine and Russia that complicates the situation. You know that Russia and Ukraine are infected countries, and of course movements of soldiers, movement of people that go far from the war complicate the situation and increase the risk to export the African swine fever. So it's of course it's complicated to find a common rule in this situation. So peace is a necessary tool to make a strategy against African swine fever.
Gracias, doctor Francesco. Doctor Sandro, no sé si va a agregar.
Dr. Francesco, Dr. Sandro, would you like to add anything?
My camera is broken. So, I think that each state must do a risk analysis. A risk analysis of introduction African swine fever virus, not only for the connection with a border state, but also because there are the risks on the virus with animal products like pork, like live animals. That is, for me, is very, very important to analyze. There are not in the world a model for the fight African swine fever all over the world. There are international approach in risk analysis, like the model with OIE, WOHA, now WOHA manual. I think that the risk analysis is more important than the disinfectant or the physical fences. This is my personal opinion, because in Sardinian, in 400 farms, only 200 are experienced an outbreak. So, question.
Gracias. Gracias, doctor Sandro.
Okay, thank you, Dr. Sandro and Dr. Francesco, for your interesting responses and your comprehensive responses. Now we will have the last question for Dr. Hunter and Dr. Sack. The question is, taking into consideration that in the Americas, several countries depend on the genetics of other nations, for example, from the US or from Europe or from imports of pork. What would you recommend for the continuation of trade?
Well, I'll take that one to start with, and if Dr. Zach has anything to add. You know, when you are dependent on another country, what you want to do is work with them on a regionalization agreement. You know, if you cannot switch your imports to another country that is still free of that particular disease, or there's another reason that you want to continue to import from the affected country, you want a regionalization agreement that will assure you that what you are being sent is free of the disease. And you can do that through regionalization agreements.
Dr. Sack, no sé si...
Dr. Sack, would you like to add something to that?
It's a great question. And I think just to add to what Dawn just said, yeah, if a country is dependent upon imports to feed their population, then they're going to have to assess what they're willing to do to continue that, either whether it's for a specific country or a specific region or hemisphere. Because in theory, we could all get ASF eventually, and then what are you going to do? You know, worst case scenario would be like, well, every country has ASF, so there's no exports, period. You know, I mean, just as a thought exercise, you know, where do you want to go as a country? And I think they have to evaluate the risk of whatever your imports are, you know, for food products or meat or whatever it is, you know, to meet your national goals.
Muchísimas gracias. Bueno,
well, thank you very much. Well, this has been a truly wonderful event. I would like to congratulate all the presenters who joined us today. This is definitely a high-level panel, and I would also like to thank all the participants who have stayed with us throughout the event. We went over our scheduled time, but that's because we have so many things to discuss. So we just want to make the most out of these events so that all of us can try to answer as many technical questions as that we may have and comments that we may have. So I would like to thank the experts once again for their participation. I would like to thank the team. I would like to thank all the interagency team that meet on a weekly basis to bring you all these topics. And I would like to invite you to join our webinar in August that will be about contingency plans for PPA. So we would like to invite you of today. And of course, this is going to be a very rich topic, and probably this will be a topic divided in two. So we look forward to seeing you then. Very soon we'll give you the dates and send out the invitations. So thank you all. And Rocio wrote in the chat that contingency plans are scheduled for August, and we would just like to foster the participation of the private and the official sector and the academia and other research centers to continue participating. Please join us and help us spread the word as we have this on a monthly basis. So thank you all for joining us, and may you all have a wonderful weekend. Goodbye.
Thank you very much from Italy.
Muchas gracias.
Thank you. Goodbye. Thank you, everybody.
Thank you.